Hi everybody. Today is Thursday the 4th of July. I guess for those of you who may be watching in the US, I could say Happy Independence Day. Um, Today I had my 8-week follow-up from surgery and I'm pleased to report all is well. Um, I don't want to kind of shy away from the truth that the first few weeks I was really tired, but emotionally everything was really good. Since then I halved my antidepressant dose and that was fine. I felt so stable, but from about week 6 onwards, I have noticed that I think my estrogen levels are dropping still and my hormones are dropping, like my stores, and so I am having a little bit of difficulty with my anxiety increasing and oh my goodness, fatigue. I am so tired all the time. Like, I'm not even joking. I will sleep for maybe 12 hours every 24 hours, but if I don't sleep for those 12 hours and I am busy or out and doing things, then you can pretty much guarantee that um, when I do have a weekend or a day where I'm not doing anything, I will sleep for like 16 hours out of 24, like 2 or 3 days running. It's like my body has to catch up. So yeah, I get super tired since the operation. And so I spoke to the surgeon about that today, and he said it's completely normal to have fatigue and to feel really tired. I've got a bit of hair here. And it's completely expected up to 3 to 6 months post-op, which I know everybody has told me, but it still like took me by surprise a little bit. Um, and I also talked to him about HRT, and he's going to refer me to the HRT clinic, so that's good. And he said I can gradually start increasing my activity and exercise, which I am so super happy about. Like, that is one of the things that I've missed the most is exercise. I don't think I've ever gone this long without exercising. And so yeah, that is absolutely amazing for me. Really happy about that. And he did say it has to be gradual though. My dad was in the room with me, like to my consultation, and he was like, "Yeah, did you hear that, Emily?" He said, "Gradually. This is not going and running half a marathon next month. This is a gradual increase. You've got to take it slowly." So yeah, that's that. I've actually been discharged from my gynecologist, or the surgeon that did my operation, and I will be referred to the HRT clinic in due course. So that's all really positive. It was also really cool because before my operation, I asked him if he would be able to take any photographs during the surgery, and they did. So I got to see some sort of pre-surgery, mid-surgery, and post-surgery photographs of my uterus and the space where my uterus used to be, and he explained to me what he'd done and everything, so that was really cool. I mean, he did explain it post-op, but I was like high on anaesthetic, so I forgot. And there's been a big discussion on one of the forums that I was on about how many internal stitches you have. So I asked the question, and my surgeon said for my operation, he did like a cauterizing sort of procedure down the sides, and then on the cervix, well, where the cervix was, he did like what would be like a running stitch. So he said, I think he said about 30, it would be like probably about 30 stitches. But then the rest was like burnt or cauterized or whatever. So yeah, that was really interesting, and yeah, really big positive outcome. One of the things that I've been talking to my psychologist about is like, who am I post-op? Like, the last goodness knows how many years of my life has been so consumed by mental illness and by basically just trying to keep myself alive. Especially the last 3 or 4 years, my whole entire being has just been about actually surviving and getting through each day. And now that is not the focus, and it's like, now what do I do? I had to give up my career, I had to give up my car, my driving license, everything. So now it's about working out who I am, who Emily is, and what I want to do in my life. And I really know that I want to work in mental health and advocate for patients and try and improve services, but the question is do I take a break from that and like find out who I am and do other things and then go back to that, or um, do I do something alongside that and carry on with it? I really don't know. There's one part of me that just wants to be like, okay, that chapter of my life needs to go in the past and I need to have a life that's not surrounding that. But then there's the other part of me that thinks I don't want anybody to go through what I went through, and I want systems and processes to be better for the people of future generations. So I think I need to advocate and I need to work to raise awareness of PMDD. So yeah, lots and lots of unknowns and sort of a little bit of unsure of my identity and who I am and what I like at the moment. But people have told me, you know, to give myself a few months and to find out who I am and then work on things from there. And I'm sure in time it will come. Lots and lots of really positive things happened in my life recently, so I'm really thankful for that. And after I saw the consultant, I went back to the psychiatric unit where I was a patient for 11 months, and I went and said thank you to everybody. So that was really lovely, and I am going to go to bed now because I'm really tired. Story of my life at the moment, but I would definitely take everything that I've dealt with post-op compared to my PMDD.